Hello, my name is Peter Cranfield. I'm a Regional Advisor and Training Programme Director for Health Education England, Midlands and East. I'm also a Technical Lead for the steering group which has developed the new Dental e-portfolio for Health Education England, Health Education and Improvement Wales and Northern Ireland Medical and Dental Training Agency. This short video is to give you an introduction into using the Dental e-portfolio for Dental Core Training. The new e-portfolio has been designed for Dental Foundation Training, Dental Core Training, all 3 years, PLVE, and for Dental Therapist Foundation Training. All of these programs are incorporated into one platform, which gives quite a lot of advantages and will make it easier as you work through your dental career. The Dental Core Training portfolio is similar in layout both to the current DFT e-portfolio and also the new one. But it contains many of the educational tools as found in the TURS e-portfolio, which is currently used within Dental Core Training. But we've brought in additional tools from the other programs as well. So this gives us great flexibility and a degree of coherence between all the e-portfolios. So as you move through your career, it will be helpful to you. Portfolios commencing on the 1st of September 2020. Names of people involved in the portfolios are being set up by the regional administrators, so all the educational supervisors, training program directors and trainees are being entered into the system by your regional local administrators. You'll receive an email with your login details, and that email will give you your URL, the web address for the e-portfolio, your username, which will be your GDC number, and also a password. If you're new to Dental Core Training or new to the profession, just qualified, and you're undertaking a 2-year Dental Foundation Training and Dental Core Training program, you might not have a GDC number yet. When your GDC number is available, the GDC number will be added to your e-portfolio and it will become your username. As we say, the portfolio is still under development, and you'll find during the first month or two things will be added and improved. So let's have a quick look at the Dental e-portfolio and see what there is there when we log in. See the things which you're going to require in your first weeks of induction. Now this is the login page. You'll see here it's fairly clear. There is a login area here, and it's got a button here which is registered team member accounts. Now you're not going to need that most of the time, but you will require it when you're setting up a patient satisfaction questionnaire, and you need to make sure that one of the members of your clinic team or your trust team are registered so they can handle the questionnaires for patients. Let's enter our trainee name, and because this is a test trainee, it's a strange username, and we'll enter a password. The first thing that will happen is you will see a data collection agreement, which I suggest you read through carefully, and when you've agreed to it, you can tick the box and then continue through to the e-portfolio. When you get the e-portfolio, you'll see this is the dashboard. Many of the educational tools are here in the different panels of the dashboard. Up at the top here, we have your name. Now, several tools associated with that. First of all, edit details. Well, you can edit your personal information. That's probably worth doing. In fact, it's a requirement. You will need to do that and put in the information which is necessary. Profile picture. Really, really important that you add this. Many people will identify the e-portfolio by your photograph, if it's patients in a patient satisfaction questionnaire, or even your assessors. They might not remember a name, but they find it much easier to recognize a face. So please add a nice photograph, a good photograph, one which is just a head and shoulders picture of you. It might be worth taking a new selfie, stand up in front of a light coloured or white coloured wall and take a selfie on your phone, and then you can upload it. The files which can be uploaded will be JPEG or PNG files. If you're using a new Apple iPhone, make sure that your phone saves the photographs as JPEGs and not in the new Apple high definition format. So you choose the file, put in the description, and save it, and your photograph will appear. There's also a change password function, and probably it's a very good thing to do. So you change the password from the random one selected by the ePortfolio to one which you are much more able to remember, and then you'll find it easier when logging in. Other tools which are here, there's a messaging system, and you'll find that there is a message system which you can use. You should find that you do have the ability to link to most of the people who you're working with in your trust or in your cohort. The other item which we've got here is a confidential notes page. Let's read the words here. It says quite clearly, any entries made in this section, although private to you, may be disclosed if requested by a relevant body. So remember that if you have written something here, nobody else will be able to see that in the scheme. Your ES won't see it, your TPD won't see it. So if you've had a particularly difficult conversation, you might want to keep a record of that, and you can write a note there, create the note, press the button, and then that'll be your title there of what it is, and it might be difficult. And then you can create the note. There we are. And that will remain there. But don't forget that in certain circumstances, the GDC or the GMC could require you to disclose that. So don't write anything which you wouldn't want them to see. Let's return to the main dashboard though of the portfolio. The items that you're going to require to start with are fairly limited. Induction checklist, you will need to address this, and you have to add the list. All these particular items need to be checked off. You can save your changes there by clicking on that button, and when you've completed it, you can send it forward so that your educational supervisor will be able to see that and mark it as complete. This is the workflow indicator. You can see here it's awaiting your completion. When you've completed it or sent it forward, that will turn green, and the educational supervisor will need to deal with it and turn to yellow from black. And then when the educational supervisor has completed, that too will turn green. Other items which you'll need at the start: personal development plan to be completed after you've spoken with your educational supervisor. And you'll see here they've got CPD log and various other useful tools. Supervised learning events are over here. These require the invitation of an assessor so they can be marked. And let's look at the DOPS under simulated conditions. So this is something we've added because of the pandemic, and quite a lot of work might be done under simulation. So let's click on Add New, and we can see here we have to fill in all the boxes here: date, descriptions, procedure. So let's fill that in, and then that will go forward to your invited assessor. There we are. Now, it won't move forward. Yes, it has moved forward. Beautiful. That's great. And now you can choose your assessor. If it's your ES or your TPD and you're already linked to those, you can just send the invitation straight to them. If it's somebody else within your department or your trust or your clinic, you know their email number and they're part of the system, you can add that, search for them, and you can find their name. There we are, and send an invitation that way. If it's somebody new or somebody who hasn't been linked to the system, you put their email address in there, send an invitation, and they then will be able to log in as an assessor using their guest account and be able to complete the assessment. Once they've done that, they'll be able to send it back to you and the workflow indicator will update itself. If we go back to the main page, you'll see here that each of the items has got little indicators here which says not started. This one has been started, so it changes to a little clock. These indicators update themselves every 5 to 10 minutes. So when you've completed something, don't expect instant change of this. It will take its time and then update itself for you. You've got an invitations log here, so when you have sent invitations to many assessors, you can't remember who you've sent them to or whether they've completed them or not, you'll be able to click on that and you'll be able to see any outstanding invitations. The rest of the tools will be covered in your induction training which you'll receive during induction, so I'm not going to dwell on those now. I wish you all the best in your dental core training year. I hope that you have a wonderful time and learn a lot and that your professional development continues apace. Thank you very much.